feeds off a supersized diet of Big Macs, big gulps, and big buckets of fried chicken. Bariatric surgery has become increasingly routine. In 2009, more than 220,000 Americans made the life-changing and often life-saving decision to have it done. Studies say it can reduce the risk of premature death by 30 to 40%.
How do you feel?
I feel great.
And significantly improve an obese person's lifespan.
Bariatric surgery, has it changed the game?
It's beginning to.
It's
beginning to.
It's changed the way you fight this thing.
Absolutely. And particularly for individuals with severe obesity. I'm not talking about 20 pounds overweight. I'm talking about 100 or more. Bariatric surgery right now is the only effective, durable treatment, period.
As soon as you're ready, I'm ready.
Okay, very good.
According to the Centers for Disease Control, 2/3 of the U.S. population is either overweight or worse, obese, a medical definition based on a person's height and weight.
Obesity is probably our leading public health issue that we face as a country.
Ken Thorpe is a health economist at Emory University and has done the first ever study on the future costs of the disease.
If nothing changes, if we don't do anything more to really prevent obesity in this country among kids and adolescents and adults, within 10 years, over 42% of the population would be considered obese. That's a public health nightmare.
His findings are staggering. He says by the year 2018, the health care bill for treating obesity-related illnesses will double what it is today and grow to $344 billion a year.
That's $1/3 trillion.
It's going to bankrupt us. It is going to bankrupt us. And the problem is not even leveling off. We're seeing very young people, children and teenagers, develop severe obesity at such a young age. So they have their entire lifetime to develop all of these expensive diseases.
Diseases like diabetes that can easily cost $50,000 a year to treat. And then there are surgeries like Henry Butler's, which aren't cheap.
How much does a procedure traditionally cost?
Roughly, a bariatric procedure is $25,000. Maybe you add another $5,000 or so in a more complex patient.
So $30,000.
Right.
That's a lot of money.
It's the price of an automobile. That's a Ford Taurus.
Butler's fortunate.